Things I wish I had known, especially from other survivors and when I was diagnosed with cancer. First of all, my hair fell out. Didn't believe the nurse when she said exactly 2 weeks to the day. She told me I should shave it, and she was right because I have pretty much long hair. It was down to here, and it's very traumatic when it comes out in the shower in clumps. So if somebody says shave your head, your hair's going to fall out, you should definitely do it. The other thing is chemo brain. Like I said before, if I look at an object and I say, "Oh," my brain says that's a pen. I can't verbalize it, and that's kind of difficult for somebody, especially when you have a job like mine when you're on the radio and somebody asks you a question and you can almost hear the crickets in your forehead and I mean in your head and hear the dead air. It's like it kind of makes you feel stupid, but it's not anything that you can do. It's because of the cancer treatment, and I find a lot of my friends, I kind of explain that to them. So if I just kind of look at them with a blank stare on my face, then they know that I'm having a hard time explaining myself to them. And that's something I wish I would have been told. The other thing is you have a hard time eating because you don't have an appetite, and a lot of the cancer treatments give you a metallic taste in your mouth. Well, one survivor told me that if you eat with plastic spoons or plastic silverware, then you won't have that much as metallic taste and you'll actually have a little bit of flavor in the food. Now, I know that sometimes the medical community is more interested in healing you than telling you about these little tidbits. And that's why I always, try to find survivors to find answers to questions like that. Like, why am I so tired afterwards? Is this going to go away as far as the tiredness? Because there's all different kinds of tiredness that I didn't know existed until I was a cancer survivor. Um, and getting to the new normal, you may not get back to where you were before because when you're in treatment, you're in like a cancer treatment bubble, and then they say, "Well, you're fine, you're done now," and then they just kind of like set you free as a cancer survivor, and you're out in the world like, "Well, I'm not sure what to do." Well, you're not the same person because of the cancer treatment or the cancer or just surviving what you've survived. So, you have to find a place that makes you happy. And I believe that most people, once they go through treatment, they turn out to be a better person than they were before.
Hi, I'm Dr. Jay Harness, and I want to share with you important information that I believe that every newly diagnosed patient with breast cancer needs to know.
I'm a breast cancer survivor.
I am a breast cancer survivor.
I am a breast cancer survivor.
And I want every woman to know
About personalized breast cancer treatment
and the genomic test.
A test that helps guide a woman and her doctor
to the best treatment options for her.
Pass it on.